One goal of an effective warm-up should be to elevate internal temperature so that the sweating occurs. Another potential outcome of a good warm-up is to enhance neuromuscular efficiency such that joint position sense improves joint stability and the enhanced and protective joint reflexive are developed. Increasing body temperature has other effects that are beneficial for exercise as well. The potential physi- physi- physiological physiological benefits of the warm up include increased metabolic rate, gradual gradual redistribution of blood flow to working muscles, decreased decreased muscles relaxation time following contraction, increased speed and force of muscle contraction, included no increased muscle tendon and ligament elastic, elastically, and gradual increase in energy production, which limits lactic acid buildup and reduced risk of abnormal heart rhythms. Many of these physiological effects have the potential to reduce the risk of injury because they may include neuromuscular coordination, delay fragile, fragile, and make the tissue less susceptible to damage. Static stretching. To stretch or not to stretch during the warm up to promote injury prevention is a much debated issue, and there are no clear conscious in the scientific literature. One approach is to perform an effective warm up that with rehearsal moves following by brief stretching with a focus on the muscle groups involved in the subsequent conditioning exercises. The warm up should contain mostly dynamic movements, but static stretches can be included if they are limited to brief periods. GFI should also consider the ab- abdomen environment, as cold weather may increase the amount of time needed to warm up. In addition, older adults will require additional warm up time compared to younger individuals. In terms of organizing a group exercise class format for the warm-up segment, begin begin performing large muscle dynamic movements and incorporated rehearsal movements. When teaching a 30-minute session, it might be perfectible to save the static stretching for the end, when it may be mostly beneficial in terms of enhancing flexibility. Conditioning segment. There are a few common principles behind the conditioning segment of most group fitness classes. For a successful class experience, a GFI should promote independence, self-responsibility, gradually increase intensity, give progression and regression options, build sequences logically and progressively, monitor intensely using the talk, test HR, or ratings of perspective expression. Incorporate a post-conditioning cool-down stretch segment. Post conditioning cool down. The final position of any fitness group session that contains moderate to vigorous intensity work should be less intense to allow the cardiorespiratory system to recover. During this final phase, GFI should encourage participants to slow down, keep the arms below the level of the heart, and put less effort into the movements. Using less driving music, changing tone of the voice, and verbalizing the transition to to the participants can create this atmosphere. Performing song static stretches at the end of the segment also works well. Participants often run off their next commitment immediately following classes, so they may risk missing important flexibility training if stretching is not included in this portion of the class format. Stretching. It is important that GFIs lead the class through stretching of the major muscle groups in this in a safe and effective manner during the final phase. Relaxation, visualizing, and specific breathing techniques may be included at the end of the flexibility segment to enhance the participant experience. GFI should consider stretching both the muscle groups that have been the focus of the group fitness class format, as well as those muscles that are commonly tight from everyday activities. For example, after an indoor cycling class, stretching the hip flexors, quad quadriceps and hamstrings, calves, hips, and glutes make sense because there are major muscles for cycling. The major muscle groups people typically use during activities of daily living. ADL can also be targeted with stretching. The American College of Sports Medicine guidelines suggest performing static stretches for 15 to 16 seconds. Completing 2 to 4 receptions per muscle group, a minimum of 2 to 3 days per week. While it is not always possible to perform 4 repetitions of each stretch in the group fitness class that is 60 minutes or less in duration, GFI should incorporate at least 2 repetition of a stretch for each major muscle group, holding each for at least 15 to 30 seconds. However, if the GFI is leading a stretching focused class, it would be ideal to follow ACSM's flexibility guidelines. There are precautions for the stretching that GFI should consider. Any type of aggressive stretching that goes beyond what an individual is accustomed to can result in pain and inflammation. All types of stretching, but perhaps more specifically, elastic stretching and passive overstretching can result in injury. Research has suggested that while these types of stretches can benefit from ROM in athletic populations, such as gymnastics and dancers, they may also decrease performance and increase the likelihood for pain and inflammation in clinical or non-athlete populations. Um, Passive overstretching and ballistic stretching can initiate an involuntary stretch reflex. Special receptors within the muscle fibers detect sudden stretches and intensive lengthening of the muscle. There is a complicated and continual interplay between opposing muscle groups that lead to precision of control and coordinate movement. During this interplay, if a muscle is activated by a sudden stretch or if continued maintains the contraction to oppose the force of excessive lengthening. Simply put, if a person overstretches or bounces a stretch, the muscle may shorten to protect itself. Repeated pulling on a shortened muscle can cause either a cramp or possibly tear, but it will not lengthen the muscle. Curing a stretch. It is important for stretching to be comfortable for participants. Encourage proper from by using cues such as find a comfortable position where you feel gentle tension and hold if you are shaking or if your muscle feels like rubber bands ready to snap. Scale back the intensity of the stretch. Also, it is important for GFIs to model average flexibility so that the participants do not imitate from they cannot comfortably or safely match. As with any other activity, it is important to progress participants appropriately. Yoga is a good example of of modality that has many participants. No, that has many advanced stretches that could be high risk for some participants. If they are taught aggressively and progressively, as is commonly done in dedicated yoga classes, the body adapts to the stretches and movements over time. However, putting advanced yoga poses into a traditional group fitness class does not allow for proper progression. Therefore, it is important that the GFI incorporate only moves that are appropriate for the class participants. Reminding participants of posture. Proper posture. Proper posture while stretching helps to promote overall body stability and balance, and enhances the effectiveness of the stretching experience. At least 2 to 3 concise verbal cues are needed during each stretch to make sure the body positioning is optimal for the effective stretch. For example, when teaching a standing hamstring stretch, it is important to cue to tilt the pelvis anteriorly to lengthen the hamstring muscles and to intend the knee as much as is safely possible. Components of health and fitness. Physical fitness is benefited as a set of measurable attributes that a person has achieved. A person who is physical fit has achieved a physiological state of well-being that allows him or her to successfully meet the demands of daily living and that provides a basis for sport performance. The most frequent cited components of physical fitness are divided into 2 groups: health-related attributes and skill-related attributes. The 5 health-related components of physical fitness are cardiorespiratory endurance, muscular strength, flexibility, body composition. These attributes are important overall health. As individuals, favorable measures of these components tend to enjoy and enhance quality of life. Fitness-related components of physical fitness include agility, coordination, balance, power, reaction time, and speed. Individuals who perform exercises to enhance these components typically have already achieved a certain level of conditioning through activities focused on improving the health-related components of physical fitness. Since these skills are required for the performance of most sport activity, skill-related physical fitness components are commonly pursued by athletes who want to maintain or improve their abilities in their chosen sport. As such, the health-related components of physical fitness are considered more important to general health than are skill-related components, which is why research on physical fitness and health primarily focus on health-related components. As the fitness industry is driven by trends, programs are continuously being created by passionate and motivated health and fitness professionals. It is important that those in the fitness industry continue to be mindful and safely and efficiency of these programs. ACSM's guidelines on experience programming for health adults can serve as a template for classes designed The current guidelines include cardiorespiratory, muscular strength and endurance, flexibility, and neuromuscular exercise recommendations. The basic training principles presented in this section apply to all forms of physical training, such as exercise programs are a result of following established training principles from exercise science research. Specifically, progressive overload and reservability are general training principles of which GFI should have a good understanding in order to provide safe and effective fitness classes. The psychological changes causes the training are highly specific in the types of activities performed. This principle of training is called specificity. Exercise is a form of stress to which the body must overcome and adapt. Each mode of exercise places its own type of stress on the body. For example, resistance training increases strength but has little effect on cardiorespiratory endurance. Furthermore, training at a specific intensity will cause a specific conditioning outcome. For example, lifting lighter loads of performing a higher number of repetition will result in training stimulus that favors muscular endurance but not muscular strength. Conversely, lifting heavier loads and performing fewer repetitions will result in an increase in muscular strength but not necessarily endurance. These low and high intensity weight training examples illustrate that there is a clear relationship between intensity of exercise and duration. Namely, high intensity exercises will be shorter in duration, whereas low intensity exercises allow for a longer duration. Another important principle of exercise is progressive overload, which states that to improve physical fitness, the exerciser must regularly increase the demands placed on the body. The amount of overload necessarily to exploit a safe and effective training response depends on the training state of the individual. A person accustomed to a sedentary lifestyle needs a very little overload stimulus to bring about a training effect. For example, a person who has been a little or bedridden for an extended period of time may notice a sufficient training stimulus after walking 100 feet. An individual who is overweight and deconditioned may notice strength improvements after performing resistance exercise using only his or her own body weight. However, an accomplished bodybuilder may need to lift relatively large amounts of weight to produce an overload and stimulate a training effect. Since each individual presents a different state of physical fitness, overload must be applied specific to individual needs for intensity, frequency, and duration. Overload that is progressed properly will allow enough time for the body to adapt, thereby improving performance. An exercise stimulus must be gradually increased over time to safely exploit continued improvements. The positive psychological effects of the exercise training are reversible when individuals discontinue their exercise programs. This is called the principle of Reversibility. Exercise com exercise com capacity um, diminishes rapidly, and within a few months of stopping their physical loss. Furthermore, complete lack of activity, such as periods of immobility due to bed rest during sickness, causes dramatic loss in strength and bone mass. The reversibility principle demonstrates the importance of use it or lose it. Being fit as an um, adolescent for a young adult does not provide continued benefits throughout the lifespan unless the exercise is maintained. Additionally, the exercise patients who suffer a setback and discontinues his or her fitness program for several months will have a start slowly and progress gradually, and the exercise regimen is started again. Summary: most group fitness classes should integrate some form of warm-up, conditioning phase, and cool-down. Cardiorespiratory resistance or flexibility exercise can be included in the conditioning portion or main body of the workout to meet the participants' goals and the objectives of the class format. Understanding and being able to apply the variable variables of frequency, intensity, duration, and exercise mode they pertain to each type of modality and or class format will help the GFI guide participants appropriately to their goal. Additionally, have working knowledge of the general training principles of the specific progressive overload, and reversibility is vital to designing and leading safe and effective group fitness classes. Understanding human movement. Exercise based on human movement principles. The body is designed to improve and develops in response to stresses placed on its individual systems. Exercise enhances the movement and activities that people perform on a daily basis. Hence, the best way to functionally prepare for the body is to train the same way in which it moves, favoring interrogation over its isolation. That is training movement, not solely muscles. Stability and mobility throughout the kinetic chain. Movement is the result of muscle force, where actions at one body segment affects successive body segments along the kinetic chain. While an individual produces forces to move, the body must also tolerate the imposed forces of any internal load, gravity pulling down on the body, and reactive forces pushing upward through the body. Consequently, the ability for an individual to improve effectively requires that his or her body possesses appropriate levels of both stability and mobility. Joint stability is the ability to maintain or control joint movement or position. It is achieved by the structures of the joints and the neuromuscular system. Joint mobility is the range of uninhibited movement around a joint or body segment. It is achieved by the structures of the joints and the neuromuscular system. While all joints demonstrate varying levels of stability and mobility, they tend to favor one over the other, depending on their function within the body. For example, while the lumbar spine demonstrates some mobility, is the general stable, protecting the low back from injury. And on the other hand, the thoracic spine is designed to be mobile, to facilitate and variety of movements in the upper extreme immense. The scapulothoracic joint is a more stable joint formed by collective muscle attaching the scapulae to the rib cage. This joint provides a solid platform for pulling and pushing movements at the glenohumeral joint and must tolerate the reflective force transferred into the body during these movements. The foot is unique as its level of stability varies during the gait cycle, giving it its need to provide a solid platform for force production against the ground during push-off, and it's stable, however, as the foot transitions from the heel strike to accepting the body weight on one leg. It moves into pronation and fights some stability in exchange for increased mobility to help absorb the impact forces. As the foot prepares to push off, the ankle moves back into supination, becomes more rigid and stable against the increased force transfer into motion. Movements in three planes. Human movement can be described as taking place in one of three planes of motion: the sagittal plane, frontal plane, and transverse plane. GFIs can better understand proper alignment and body mechanics as it is applied to affect exercise program designed when they have a good grasp on how the body improves in these three planes, while movement and positions of sometimes multiplanar. Understanding each plane individually is critical to both teaching and recognizing safe and effective movement. Sagittal plane. Sagittal plane separates the body into a right and left halves. Forward and back movements occur in sagittal plane. Think of standing in a doorway and moving away from the frame forward and back. Possible joint actions are flexion, elbow, shoulders, knees, hips, and spine, extension, plantar flexion, and dorsiflexion. Practical application. Most indoor cycling classes occur in the sagittal plane. Many submine plights, exercise, and traditional abdominal crunches also occur in the sagittal plane, as well as many resistance training exercises such as squats and lunges. Frontal plane. The frontal plane separates the body into anterior and posterior halves. Lateral movements occur in the frontal plane. Think of moving sideways between two planes of glass while trying not to touch them. Possible joints actions are abduction, shoulders and hips, and abduction. Lateral spine flexion, ankle extension, and inversion. Practical applications. Many standing yoga postures like star pose occur in the frontal plane. Equivalent fitness exercises like jumping jacks and TikToks also occur in frontal plane, as do common group exercise movements like the lateral lunge. Transverse plane. Transverse plane. The transverse plane divides the body into upper and lower parts. Rotational or twisting movements primarily occurs in transverse plane. In the transverse plane, think of rotating the rib cage in one direction while the pelvis moves in the opposite direction. Possible actions are rotation and horizontal, shoulder adduction and abduction. Practical applications: yoga and Pilates twists occur in the transverse plane, as do abdominal core exercises involve rotation such as supine bicycle crunches and seated medicine ball trunk rotations. Five primary movement patterns. In addition to understanding movements in terms of the planes of motion, it is also beneficial think of exercises in terms of their application to activities of the daily living. Specifically movements of everyday life can be broken down and described by five primary movements: bend and lift movements, single leg movements, upper body pushing movements, upper body pulling movements, rotational movements. GFI should incorporate a variety of exercise into classes to help participants effectively train these important movements in order to enhance how they move both inside and outside of the group fitness environment. Um, balance and group exercise. As discussed in Chapter 2, a well-rounded fitness routine includes cardiorespiratory strength, and flexibility exercise, as well as a balance and agility training. If the goal of a class is to increase muscular strength and cardiorespiratory fitness, both of these components will be addressed within the same class format. GFIs choose to focus on one component before the other, or elect an alternate between the two in a circuit style format. If the goal of the class is to increase flexibility, this can either become a class of itself, or specific flexibility exercises can be performed at the end of a strength, cardiorespiratory, and fusion class, as it is most effective to stretch muscles that are properly warmed and therefore be pliable. As the instructor, is important to understand that all participants should engage the cardiorespiratory strength and flexibility training. A well-rounded fitness program that incorporates these three elements reflects that concept of balance. Overall, the principles of balance applies in a group exercise in three ways: neuromuscular, being able to stand on one leg, being able to stand equally supported up on both feet, raising one arm or one leg in the quadruped position, maintaining neutral pelvic position and spinal posture, executing exercises on an unstable surface as appropriate, and raising one knee or foot off the floor in plank position. Training both sides of the body need to be trained equally, because together they connect and create a whole. This type of approach is called bilateral Bilateral training. Instructors who train with unilateral approach during cardiorespiratory moves uh, or strength moves. The right foot step forward. No, wait. Strength moves fail to interrogate this principle of balance in their classes. When GFIs teach movement patterns that utilize both sides of given movement pattern, the movement pattern is called transitional and reversible because the movement is repeated on both sides and or in both directions to ensure this type of balance. Balance is training also means that an individual should strive to be equally balanced among the three key components of training: cardiorespiratory, strength, and flexibility training. For example, if a participant only attends indoor cycling classes, he and she should seek out additional models of exercises that focus on muscular strength and endurance training, as well as as well such as a group fitness class that includes resistance training exercises, especially for the upper body. Similarly, a yoga enthusiastic should seek out modes of cardiorespiratory training to complement his or her yoga practice, such as dance-based fitness classes. And lastly, programming. Instructors should consider opposing muscles, as well as varying planes of motion when choosing exercise and movements for their participants. As a cardiorespiratory example, always doing movement in the frontal plane with exercise like grapevines instead of sometimes incorporating marching front and back or twisting would not only be boring but would also limit the participants from experiencing exercise in all three planes of movement. As a strength endurance example, performing bicep curls in a group of class without a exercise for the triceps would not be well balanced for the muscles of the upper arm. Energy pathways. The energy to move and think comes from the foods people eat and drink. Carbohydrates are easy for the body to break down and provide quick energy, while fats provide an seemingly endless support of stored energy. Proteins are the building blocks of human structure and are not a primary source of energy. The body stores carbohydrates and fats in their most basic forms: glucose and triglycerides, respectively. When the body needs energy, it breaks down the chemical bonds in the stored energy, releasing adenosine and triphosphan, the basic substance that the body uses for energy. Hold on. Exercise intensely. The duration determine the fuel sources used. Generally, there is a inverse relationship between exercise intensity and duration. The more intense the workout, the less time participants are able to maintain intensity. When people work at the extreme intensities for just seconds, they used up the small amounts of creatine phosphate they have in the body via the creatine phosphate system, phosphagen system. The to produce ATP. An example is sprinting as fast as possible, which people can generally sustain for only a few seconds. When people work at hard intensities for a few minutes, they used up carbohydrate stores via the glycolytic anaerobic system, which can provide ATP without oxygen. An example is doing high intensity intervals lasting 1 to 2 minutes and then having to recover while breathing in oxygen to replenish the muscles before continuing. When people work at moderate and low intensities for longer than a few minutes, they use a combination of carbohydrates and fats to produce ATP for energy to move. This is accomplished via the aerobi, aero, aero, aerobiotic aerobiot, aero, aerobic system, as sufficient oxygen presents for the production of all ATP. Examples of this include swimming, most moments in cardiorespiratory classes, and stepping classes. Three-zone intensity model, a fairly reliable intensity marker, is able to talk during exertion. For simplicity, exercisers can use a three-zone model to gauge appropriate exertion during cardiorespiratory activity, where zone 1 is low to moderate intensity exercise during which the exerciser can talk comfortably. Zone 2 is a moderate to vigorous intensity aerobic exercise during which talking is a little challenging but still possible. Zone 3 is vigorous and very vigorous exercise to very vigorous exercise during which that exerciser definitely cannot talk comfortably. The three zones are separated by each participant's unique metabolic markers, known as the ventillary threshold, where talking first becomes a little challenging, and the second ventillary threshold, where talking becomes very difficult, is reduced to 1 or 2 words at a time. This simple model can be used for GFIs in class settings, as they seek to gauge the intensity at which participants are working. And GFIs can simply ask participants questions and listen for responses during the conditioning proportion of class. It is important to educate participants on the concept of the three-zone intensity model and how it relates to talking, as doing so many expect more responses from participants if they know the GFI is relying on their vocals cues and as a way to monitor intensity, referring to chapter 4 for more information on the talking test. ACE interrogated Fitness training model. Finish, finish, Fitness facilities a face the mounting challenges associated with the aging and increasingly overweight population, as well as overburdened healthcare systems that is often unable to meet the need for preventive care. Health and fitness professionals include GFIs are seeing an influx of participants with an increasingly long list of special consideration, creating confusion as they attempt to develop group fitness classes that safely and effectively address individual needs. It is important that GFIs look at their classes and individual participants from multiple perspectives in order to keep people excited to continue exercising. Unlike personal trainers who specifically design an exercise program for a given client, GFIs must first program for the group before offering progressions or regressions for individual participants who may be various phases of the ACE-IFT model. The core challenge of many GFIs, whether they are novice or finding a balance between instructing the entire group and making sure individual classes participants progress appropriately and safely. For this reason, GFI should always communicate to participants that it is their responsibility to manage their movements and work within their personal fitness levels. One situation in which the ACE-IFT model may be applied more directly in the group setting involves the development of longer-term group programming for participants who begin a program together and progress as a group. For example, a GFI may lead a 6-week boot camp program or guide a group for new mothers through postpartum return to exercise. In these cases, pre-participation screening can be used to classify an individual's health fitness level both as a baseline against which to measure future success as a tool to improve motivation and adherence. Anatomy overview. GFIs do not need to be expert anatomists in order to teach safe and effective exercise classes. However, a basic understanding of how gross anatomy, specifically the structure and function of bones and muscles, is required for the successful exercise instruction. Bones become familiar with the name of the major bones of the body can be helpful, as a GFI can reference them when providing verbal, anatomical, and alignment cues. Using the correct names of bones do not only make structures more creditable, but also helpful to truly educate participants about their bodies. Figure 3 to 9 illustrates the major bones of the skeletal system, while figures 3 to 10 illustrates the bones of the spine. While not an exclusive list, Table 3.1 represents the series of practical examples of what types of cues instructors from various disciplines could use when referencing bones. Muscles. In general, GFI should know where the muscles is associated is located and what joint or joints it crosses. Many muscles in the front or anterior part of the body are primarily used for pushing movements, while many muscles in the back of the posterior part of the body are primarily used for pulling movements. When the angle between any two bones decreases, it is called joint flexion. This typically occurs as a result of a muscle pulling on its attachments and shortening. Conversely, when the angle between joints increase, it is called joint extension, and it is usually the result of the muscle on the flexion side of the joint lengthening while the opposing muscle on the other side of the joint pulls and shortens. The preflex hyper means extensive, so hyperflexion occurs when the limb or part of the body is flexed beyond a normal range of motion. Similarly, hyperextension occurs when there is movement at a joint into a position beyond the joint normal maximal extension. Two important examples of these concepts occur at the elbow and knees. In cycling, many participants hyperextend their elbows as they prop themselves up on the handlebars, producing tension and stability throughout the core. In strength training, many participants hyperflex their knees when they squat, moving the knees towards and forward instead of concentrating on hiding at the hips and lowering at the glutes. Lowering the glutes. The importance of posture. The principle of balance discussed earlier also applies in general posture, as it helps one understand the neutral posture means that all of the muscles work on the body's center equality. When any muscle or muscle group pulls too shortly or becomes too tight, this can create an imbalance. Similarly, when a muscle or muscle group is too weak, it may not pull strongly enough or execute its intended movement. A unique aspect of the trunk is how it functions as the tunnel through which all systems connect. The center of the core is the pelvic floor, and core training involves in general isomeric tightening of these muscles, in addition to activating the transverse abdominis, which compresses and protects the core and stabilizes the spine. One way to describe the fitness-related function of the transverse abdominis is to think about kinking a belt around the waist, drawing in the core muscles almost as if to appear slimmer through the midsection. The technique of bracing, performed in conjunction with pelvic floor maneuver, activates the core and can enhance overall core function. During classes, whether they focus on cardiorespiratory strength or flexibility training. Neutral posture involves an equal amount of static isomeric tension on the anterior and posterior muscles of the core. There is a mutual relationship between the ribs and the hips, where there is a no longer exaggeration in either direction of the spine. Has 7 cervical vibrate, 12 thoracic vertebrae, 5 lumbar vertebrae, 5 fusion vertebrae called the sacrum. The 4 fused vertebrae at the bottom called the coccyx. Because the natural aligned spine is neither straight nor flat, instructors can use the words natural, neutral, alignment, lengthen, tall, and proud instead of terms that do not accurately describe the way vertebrae should align. While some spinal conversions is natural, deviations in the spine are common and occur when someone has an exaggeration of these curves. Faulty posture examples. Lordosis. When standing tall in the erect posture, all joints are in extension. When someone's pelvic tilts forward, this is called the anterior pelvic tilt and usually denotes an exaggerated lumbar curve called lordosis. Often the spinal erectors are pulling too shortly in the back, while the hip flexors are pulling too strongly in the front. Individuals are most likely need to focus on strengthening their abdominal muscles and hips extensors, in addition to stretching the spinal erectors and hip flexors. Excessive posterior curvature of the thoracic spine, referred as the kyphosis, is marked by rounding of the upper back, often accompanied by the anterior pelvic tilt, somewhat similar, and increase the rounding of the thoracic spine along with the forward head position, and rounding shoulders may be also accompanied by the posterior pelvic tilt, in which the pelvis tilts backwards. In both instances, individuals will likely need to strengthen the middle lower trapezius and rhomboids that pull the shoulder blades back, as well as to strengthen the anterior spiny group to increase the anterior space between the ribs and hips. It is important to encourage stretching of the chest in addition to addressing muscular imbalances related to respective positioning of the pelvis. When the participant's spine is an S shape, where the pelvis and shoulders appear uneven when looking at them from the front and back, it may be scoliosis. It is individuals has pain cannot assume a neutral spine position. He or she should be referred to an appropriate medical professional. Applied anatomy. The most practical way to apply the structural concepts of anatomy is to relate to how the body moves and functions. In fitness classes, the various exercises and movements of the body can be categorized into 10 positions. GFIs have an understanding of what neutral position of the spine both looks and feels like in each of these positions. Instructors must also understand what the extremities of distal body parts look like and feel like. Figures 3 to 33 and 3 to 42 present names and clues for each of the major positions of the body. Pictured are common movements of the plethora of groups, fitness disciplines to illustrate some common exercises that fall within each of the categories. Summary: understanding human movement provides the most practical approaches to exercise instruction available to the GFI. This chapter has provided a brief region by region summary of the basic anatomy and movements of the body, along with information and posture alignment and program design principles associated with the GFI IFT model. A GFI can draw on this information to design and implement specific exercise that will safely and effectively accomplish the goals of his or her group fitness